Hello, everyone. Good morning and good afternoon. And you're all welcome to this webinar titled Shaping Nigeria's Climate and Health Agenda. As you are all aware, we are all at a tipping point. The world is at a tipping point. Nigeria, even more so. And as we're all aware, climate change is a risk multiplier across the full spectrum of health priorities and the health system. And that's why the ongoing transformational health system reform agenda in Nigeria prioritizes efforts to both adapt and mitigate the impact of climate change in the health system. So today we hope to go through the gamut of first, how does the climate change impact the health system globally? What are we seeing? And then we begin to look at some of the ways that it has impacted Nigeria, in particular across maternal health, nutrition, amongst other things. How do we even know that this is true in terms of what are the ongoing assessments that's been done? And then we begin to look at first, how do we finance the efforts to address those things? And how do we build an ecosystem of partnership, of collaboration to address this major crisis? As you all know, next week there's a series of events, including a climate and health workshop and our Future of Health workshop, which this year's theme focuses on the climate and health agenda. We indeed have lined up a number of specialists in this field to help us shed some more light, provide some foundational information for us so that we can begin to see why this is a priority. Because indeed, even as we speak, we are already beginning to see distress on the health system. For instance, if you have someone in Maiduguri currently, you'll be surprised to know the number of PHCs, secondary health centers, including tertiary hospitals, that are literally overrun by flood water. I mean, this is just a very recent example, but there's also a much more salient issue going on. If, for instance, you look at how climate change is impacting maternal and neonatal health, which is a key priority under the Nigeria Health Sector Reform Investment Initiative. So, without much ado, I will pass, the floor to Dave McNullo, who is the head of health at the FCDO, to set the stage for what we know in terms of climate and health and how it impacts the health system. Okay, now we are able to put on our video. So, Dave, if you can just help us lay the foundation. And glad to also know that Edwin has joined. So I take it that if yourself and Edwin, we are both able to give us the contextual framework in terms of how climate and health uh, impacts the health systems. So, Dave, I hand over to both yourself and Edwin.
Yeah, sure. Thanks so much, Olumide. I'm also don't seem to be able to put my video on, but nevertheless, I can. I'll carry on. I think you can live without seeing me. So maybe what I'll do is just highlight a few elements of why climate and health is important for Nigeria, and then I'll pass over to my colleague from the WHO, Edwin, who'll talk a little bit more on the link between climate and health. But we're conscious that there's a 2-day workshop next week. So what we'll do is really go quite light on this, and just it's really about just whetting your appetite. But next week in the workshops, and obviously on the 24th at the Health Watch conference, there'll be much more information, much more detail. So really, just please take this as an introduction. Vivian, I'm not sure if I'm able to share my screen. Maybe I can just go into presentation mode and that will work. Can I just check if you're able to?
Yes, Dave, you can. You're a co-host.
Okay, I'm on there now. Okay, great. Okay, great. Can someone just confirm that they can see my presentation?
Yes, we can.
You can. Great. Okay. Well, look, we'll do this quickly because, as I say, you'll get much more detail next week. But we'll just briefly cover something around the link between climate and health, and Edwin will go into that in more detail for you, and we'll talk something about Nigeria's ambitions and commitments and why climate and health really is important for Nigeria, and what Nigeria has, and the commitments that Nigeria has made, which have massive implications at the federal, state, government levels, but also really importantly within the communities throughout Nigeria. And then we'll talk a little bit about the progress on climate health within Nigeria, particularly the recent drive in this area. And I think it's really an exciting period in Nigeria on climate and health, and we're really trying to bring everybody along with us as we move forward. So as I say, I won't talk too much about this because everyone will go into it more. But the link between climate and health is now well established, and there's really no argument about this. So we know that rising temperatures will see rising sea levels, and we'll see massive increased weather events. And the implications of this, they're all really health implications. So we already know that in the current period, 3.5 billion people live in areas of which are highly susceptible to the impacts of climate change. So this isn't something that's coming; it's something that's here. And we also know that we have an aging population, but across the world, we know that there has been a large increase. I think about 50% increase in the number of over 65s who are dying from heat-related stress. So these are here and now. And it will have big implications particularly in terms of nutrition, undernutrition, which has in turn massive impacts on maternal neonatal mortality, but also the development of children into adults and their potential productivity. But there's also really interesting climate change and air pollution are two different things, but they have a very, very strong relationship in the sense that poor air quality, air pollution is caused by burning of fossil fuels, and this has implications in terms of 7 to 9 million deaths every year, and increasing, and particularly increasing as you have lower levels of resilience within communities. And then I think probably the last one to highlight is around water quality and water stress. So this will have big implications in terms of managing health services, health systems, but also within the communities and the spreads of diseases, diarrheal diseases, nutritional intake. And so we predict that by 2040, 1 in 4 children will live in areas of high water stress. And that's not to say children don't already live in areas of high water stress. This is already here, and it's already happening. And I think probably one of the kind of key areas for why we need to plan for this, if the previous facts and linkages didn't convince you, is it will drive health inequality. So everybody will not be affected the same, or everyone's health will not be affected the same from climate change. So it will be the impacts will be distributed differently by geography. So in the global north, the impacts will be much less than countries, depending what the geography, the services, the infrastructure, and the people who are living there. But one of the key groups which will endure the highest impact inequalities is women and children. And we already know that women and children are 14 times more likely to be killed in natural disasters, and that's expected to increase. They're also heavily dependent on access to quality health services. Health services at the moment, we know, are not built and not being designed to be resilient to the impacts of climate change, and are incredibly susceptible. And so therefore, actually, particularly when women need access to health services, particularly around antenatal, during the birth cycle, and postnatal, there will be impact in terms of their access to that, which will then lead to increases in neonatal and maternal mortality. And we talked about the fact that whether it's climate change is already here, it's already affecting us, and people are seeing this. We can see in particular areas within Nigeria where the temperatures now every year for long periods breaking records. And for example, we were in a primary healthcare facility in Kano a few months ago, and we were they were running the clinic outside the healthcare facility because it was too hot. So outside the healthcare facility, it was 43 degrees. It's hard we didn't have a thermometer, but it was unbearable within the health facility. And that's a health facility where women go to give birth. So it's here, but that will get worse. We will see more impacts of heat, more impacts of flood, changing disease distribution and intensity. So we need to plan purposefully and strategically, but we need to do that planning and that response based on the evidence that we have of how we as a community within Nigeria, how we are vulnerable to climate change and how that changes across our geographies, and then what are the evidence-based interventions to address those vulnerabilities. So also, I would say, I won't go into these in great detail, but Nigeria is already showing lots of ambition on climate and health. So there was the COP26 health program. Now, COP, for those of you who don't know, I'm sure most of you do, is essentially a big global meeting that happens every year where heads of state and civil society and other groups come together and to talk about how they're going to deal with climate change, both in terms of reducing or minimizing emissions and also building up the resilience of populations, the impacts of climate change. And at COP26, 85 countries made a commitment to build climate resilient and sustainable health systems. So these are health systems that can withstand the impacts of climate change and still support their populations who are vulnerable during those events, but also that would build their capacity in a way that was less dependent on fossil fuels. And that's really about making sure that we have reliable sources of sustainable energy, because most of our health facilities at the moment, or many, do not have a reliable source of energy. So how do we build that up to work like that? So, and Nigeria very much led the way for Africa with a really commitment. And so of course now part of the next approach is how do we then deliver on that commitment? But also within the health sector, we have the sector-wide approach, and we have a World Bank program called the Hope PHE program, which I'm sure Olumide, as one of the leads on that, will talk more about it. But this again was the World Bank program is really positioned to support the government on its ambitions for health sector transformation. And it was really great to see within this very large program a really strong emphasis on climate resilience of the health system, both at the primary healthcare level, in secondary care hospitals, but also in terms of developing a health national adaptation plan, so laying out how Nigeria will respond to the vulnerabilities of its populations to climate change. And so all of this was in there with very, very substantial financial incentives to then deliver on this. This is a real statement of intent of the government of Nigeria, with partners coming behind to support that. So what I'd say is now we are moving at pace, and you'll hear about several of the things that are happening at quite a high level, and we'll get into more of the detail on that on Tuesday and Wednesday. But things are already happening. I mean, just over the last 12 months, there's been a climate and health vulnerability and adaptation assessment has been completed, which really gives us the evidence base to understand where our health outcomes are vulnerable to climate change across the geographies and populations within Nigeria. And then we will use that information, or are using that information, for government address those vulnerabilities, and really will give us a very key set of priorities that we're going to push for within Nigeria. It's also really satisfying that we will see health as being one of the strategic themes within Nigeria's nationally determined contribution. This is the plan that Nigeria sets out every 5 years to say how it will tackle climate change. And so we will be looking for some really strong ambition from Nigeria on health within that. And we also have many projects on the ground now. So we have projects which are already looking at building climate resilience within healthcare facilities, developing approaches to climate resilience, environmentally sustainable healthcare waste management, solarization of the health system to provide reliable, safe and sustainable energy sources, and many more. But this is the beginning, really. If we're being completely honest with ourselves, there has work been done, there is work going on, but this is the beginning. But we are now moving at pace. Let me stop there. Hopefully that's given you a sense of why we need to move forward on this, and obviously much more detail will be available at the workshop on the 22nd and 23rd. But let me pass over to my colleague from WHO, Dr. Edwin. Edwin, over to you.
Yeah, over to you. Thank you so much, Deb, for very insightful presentation and analysis. And it's my pleasure to join colleagues and Nigerians all over who are part of the discussion. I just want to highlight or speak to three important things. One, to look at some of the risks of climate change and health, and then to look at what should be the focus area, and then to extract some of the key issues on the projects ongoing and how we can scale it to make sure that it delivers impacts to Nigerians. It's important to mention, my name is Dr. Edwin Isotu, and I'm the focal point for climate change and health in WHO Nigeria. It's important to mention that when you look at climate change, other determinants of health, the health sector, or the health itself, is the human face of every climatic or environmental related disaster. When any of the disasters strikes, any of the challenges strikes, the phase that you can see that receive the impact, of course, is the health sector. And it's important that the health sector is not just part of the discussion, but it's part of the solution. So that is why if you look at the burden of diseases in Nigeria, 29% of the national burden of disease in Nigeria is attributable to risk factor from environment. And lately, with the survey and the analysis we've done by the country on the VA, you can see that the climatic risk has risen to about 21% of the national burden. So when we are looking at the climate change and health risks, you're actually looking at one, what are those health-related disasters? What are those vulnerability factors, and what also had exposures? So when you look at the health-related disasters in Nigeria, which include extreme weather events, we have recently, in fact, in the last 2 weeks, if you've been flying from Lagos to other part of the world or other part of Nigeria, you discovered that there were issues with a lot of turbulences and all of that. So Nigeria is already having a big hit of it. Of extreme weather events, which resulted in much of flash flooding that is experienced across the world. Even in Nigeria, if you're in states like Kogi, in Adamawa, in Lagos, in Port Harcourt, in Anambra, and also part of the Northeast affected by the issues of the dam, you see that there are a lot of incidents of weather-related issues. And these issues, at the end of the day, it triangulates into waterborne diseases that are experienced at the level of the health facility. But important also to mention is not just weather events, also issues around extreme heat. I and Dave and colleagues from UNICEF were in one of the health facilities in Kano earlier this year. And while we're even in one of the hotel, the temperature has risen to almost 45 degrees Celsius. And unfortunately, the local community are not even aware that there is an increase. What they know is that the sun is too hot today, but they don't know that it is exceeding the threshold. And that also has implication, to the whole body chemistry and rehydration. And sometimes you see children in open places under the heat of the sun. It's also important looking at the geographical landscape of Nigeria. You will see that states like Lagos, places like Port Harcourt, which is at the sea, close to the sea, are quite predisposed to sea level rises, and these sea level rises bring issues of flood. And when we are talking about flood that have climate-related flood from the sea, not from flash flood, from the sea, you understand that when the water flows to the bank, it increases also the water table in those local areas. Apart from the fact that it displaces people in their homes, the water quality, let's say for a place like Makoko in Lagos, a place like Oyorokoto in Rivers State, place like Oron in Akwa Ibom State, discover that these areas, because they're close to the sea, the quality of water that is already there is affected because of the saltwater intrusion, and that has a lot of implication for health. The surface water is exposed to contamination, and that we begin to see triggers of cholera, outbreaks, and so many other diseases. It's important also to look at it when we are looking at climatic issues, looking at things around air pollution, which they've highlighted. Currently, about four major cities in Nigeria are currently monitoring air pollution, but even with the monitoring and with the results, we are seeing that PM 2.5, talking about particulate matter, exceeds WHO recommendation. We've had such issues even in Port Harcourt, where we had black soot 2018, which was heavily due to hydrocarbon pollution that are also climatically related. We also see a surge to or challenges around vector-borne diseases, distribution of vector and ecology. In 2019, I was privileged to work closely with the then DG of the NCDC, Dr. Chikwe, when we piloted the first One Health multi-sectoral intervention in Owo and Osei, in Edo and on those states where there is a Lassa fever outbreak. Now, you will also see that the Lassa fever has not just started in this area, it's moving because of the ecology of the vector, Mastomys natalis, and most of the forested areas in Nigeria, we're supposed to have 25% of our land forested by global standard. Rightly, we are doing about 8.5, meaning that people go demolish our deforest, and then without building, without replanting all the trees and other things. So when you look at it from a more of a whole health system perspective, it's going to have impact on the health workforce. It has impact on the health infrastructure. It also has impact on essential health services, on commodities and systems. And you look at the vulnerability, you discover that when these things strike, women, elderly people are deeply affected, and the capacity of the health system to respond is not there. The capacity is not optimal. And that is why Nigeria has embarked on the vulnerability assessment and also developing a health national adaptation plan. And when we are looking at the plan and looking at the health sector approach, globally, there is a WHO guidance. And in that guidance, you are looking at three major areas. When you're looking at climate change and health, you're looking at one, managing and addressing the health risk, which may come into injuries, air-related issues, respiratory diseases, waterborne diseases, zoonosis, and vector, and all of that. But a very key important component is around decarbonizing the health sector, from green procurement to looking at solar energy, looking at issue of retrofitting the systems within the health sector, commodities, and all of that to make sure that they are low carbon, they are climate smart, and they are able to reduce emission, the footprint within the health sector, including efficient management of healthcare waste. The third component is around maximizing the co-benefits of health action. And it's high time we should not be only talking about health as a single standing entity in a sector, but looking at health in all policies, health in health for all and all for health. And that brings to importance the importance of maximizing co-benefit from other sectors like agriculture, like environment. And the beautiful thing is that in 2018, NCDC, under Dr. Chikwe, were able to develop the One Health multi-sectoral plan that connects those doctors. But beyond those policies and plans, we need to triangulate into real actionable things that needs to, people begin to feel it at the level of the health facility through looking at essential climate health services that needs to, and we are also happy for the synergy and the collaboration, the partnership. We are working at a country, the WHO, the FCDO, working closely with the Ministry of Health, the SWAP office, and many other partners who are coming to support. And we're happy that Health Watch is coming in as one of the global, as one of the national institutions that is advancing health in Nigeria to come into this conversation. Maybe I will just pause here, and if maybe one other questions and things are coming, we'll be happy to respond. Thank you.
Thank you very much, Dr. Dave. Thank you very much, Dr. Ede. In fact, you've already crossed to the next session, which is the impact of climate change on the health system. Perhaps only for me to emphasize that the consequences in terms of Nigeria's future competitiveness, the future of a country like Nigeria is dependent on its intellectual capital, on the quality of human capital that people take forward. Yet, where you have a country that has a high level of stunting, a high level of wasting, then our future competitiveness is under query. And I'm arguing that this is further compounded or complicated by this emerging climate change crisis. And we have some data that can back that up. Look, the number of adolescent girls between 15 to 49, adolescent girls and women between 15 and 49 who are undernourished is increasing from about 6 million to about 8 million. You know, so it means that even the kids that are preconceptual by the time they are born are starting from a pretty low base. Furthermore, the number of stunted children in Nigeria is about the second highest in the world. Wasting is also seen in about 7% of children. Yes, there are some immediate consequences, but the long-term implication of this is in terms of how it situates Nigeria in terms of its human capital potential. So I think we should move on swiftly. Just if someone from the Nigeria Health Watch can confirm to me whether we have Mr. Brooks from Federal Ministry of Health, whether he has joined now. I am still expecting him to join. Otherwise, I will also move on to the Alcyon team. I think that will be Peter and David, just to tell us, you know, some of the numbers that we're bandied about in terms of Nigeria's performance in terms of the assessments that are being currently undertaken. What's coming out of that, so that some of the naysayers can begin to understand that we're coming from a very well informed position. So do we have the Alcyon guys, Dr. Peter Tafa and Dr. Obi? If you can put on your cameras and introduce yourself as well.
Good morning, dear colleagues. Yes, we are very much here, but Dr. Obi will make the presentation. Dr. Obi, if you are ready, the floor is ours now.
Yes. Yeah. Good morning, everybody. I hope I'm audible.
Yes.
Can everybody hear me? Yeah, thank you. Okay, I'll just put on, let me just put on a few slides. Can you just allow me to share some slides? Hello, okay, if that's not possible.
Will yes,
go
Dr.
ahead.
Obi.
Go ahead.
Yes, Dr. Obi, you can share your slides.
Okay. Sure. Okay, is it visible now? Can you see it?
Yes, we can see. If you can then now go to presentation mode.
Okay, okay. That's better? Is it okay?
Yes, sir. Please go ahead.
Go ahead from slide 1.
Yeah. Okay. Well, basically, I have just about 10 minutes, but what basically we have done an assessment in the country and on the vulnerability and adaptation assessment. And basically what I'll just briefly run through is about what findings were from the assessment. VNA was carried out between the months of January and to July this year. And the main objective was to provide a baseline and future projections of vulnerability, capacity, and future risks of Nigeria's health sector, and then our capacity to adapt to the impacts of climate change. The basis for the study was guided by the WHO's Climate Change and Health VNA assessment guidelines. And VNA, basically in conducting it, there's a guideline that the WHO has put forward, which we utilized. And then there's the WHO climate change operational framework, and then the pillars of health. So these were the basis on which we conducted the assessment. The VNA is evidence-based and is now being used to develop the Nigeria's Health National Adaptation Plan. That is ongoing, and we are carrying that out with the Federal Ministry of Health and other technical working group members and stakeholders. The VNA is proposed that we will launch it by the end of the year, if possible. We are still waiting for the Ministry of Health to give us the go-ahead for the launch date. Now, background to the VNA, the operational framework for Nigeria's VNA was built on the WHO's 6 building blocks for the health system. The 6 building blocks of the health system is built on 6 building blocks, which is on leadership and governance, health financing, health workforce, health information, and essential medical products and technologies, and then service delivery. Further to this, we have the 10 building blocks which is the WHO's framework on climate change resilience. And there are 10 building blocks to that, which are dependent on the health system building blocks. Again, it's on leadership and governance, climate financing, health workforce, then vulnerability, capacity, and adaptation assessment, which is the VNA, which we have carried out, integrated risk monitoring and early warnings, health and climate research, climate resilient and sustainable technologies and infrastructure, management of environmental determinants of health, climate informed health programs, and then emergency preparedness and management. In addition to utilizing these framework, the VNA explored the impact of climate change against 9 health outcomes that are mostly at risk from climate change. Edwin has talked a little bit on this. Well, that is on injury and mortality from extreme weather events like extreme heat conditions, flooding, drought, heat-related illnesses, which has been mentioned here about the experience in Kano, waterborne diseases, vector-borne diseases, malnutrition as a result of conditions like drought in the northern states of the country, respiratory illness due to, he's mentioned the PM 2.5 issues, then zoonoses. We all know that because of climate change impacts, especially in the northeastern and northwestern parts of the country, there's been a lot of mobility of pastoralists. Animals are moving from the northern parts of the country down to the southern part of the country. Apart from the conflict issues that this entails and involves, we have the challenges of zoonoses, people coming in contact with ailments and diseases that they had not yet been in contact with before. And then, of course, there are non-communicable disease challenges like cardiovascular diseases. And then, of course, one that we most of the time neglect a lot, which is mental and psychological impacts of climate change challenges due to things like flooding. And people go through a lot of challenges, and we have things like post-traumatic distress syndromes, anxiety, and all sorts of stress. Now, the key messages that we got from the V&A that is that climate change is real. It is impacting on the countries. Areas which were previously classified as medium, which were classified as medium to high risk, are expected to escalate to very high risks. Low and medium risk zones, like areas in the middle belts of the country and parts of the southwest and southeast, which were classified as medium, are likely because of impacts. They've mentioned issues of places like Anambra now, where flooding has become part of the challenges, Kogi and the rest of them. So these areas, the ratings are going to go up to high risk. The locations that were previously considered as low risk in the south are escalated to medium risk. Under all scenarios, and despite any effects on behalf of Nigeria, the country's risk to climate change is increasing. Nigeria will experience an additional 21% burden of disease due to climate change. This is part of our findings. Temperatures will continue to rise across the country. We expect by approximately 1 degree Celsius to about 1.1 degrees Celsius between now and 2050. That's on in a mid scenario. In extreme scenarios, it might go up to 3 degrees Celsius, and so there's a need to actually take mitigation actions quite seriously. The percentage of the population exposed annually to these increased heat events and flooding events, extreme weather events, is projected to quadruple from today's population growth in Nigeria. These changes will obviously be much increased in terms of the number of people that will be impacted. Nigeria will be exposed to increased rainfall that will be experienced across much of the country. Apart from the increase in rainfall, the duration and the periods of expectation are changing. We've just seen what has happened in Maiduguri, which Dave talked about, and recently there's been flooding in Kogi, there's been flooding in Anambra State and in parts of Delta. Under the most severe scenario, sea level is predicted to rise between 0.5 and 1 meter, and this is real. It's we were in Ayetoro for a project recently, and when we went there 2 years ago, the shoreline was about 500 meters away. A lot of the houses that we saw 2 years ago, when we went back this year, have completely vanished. And so the issue of shoreline is real. The summary of the vulnerabilities, well, what we found out is that the areas in the northwest and northeast of the country will be more impacted. They are the areas that have the highest risk challenges. That is the states like Kebbi, Zamfara, Katsina, Bauchi, and Yobe. Areas of high vulnerabilities, but not as much as those mentioned in the northwest and northeast. Eastern parts of Niger State, the north central zones, and then parts of Cross River State and parts of Imo and Abia State. Medium vulnerabilities are some states in the northeast like Gombe State, Plateau, Benue, and then states in the some parts of the southeast, and then lower vulnerabilities are states in the southwest, and some states in the southeast, and some in the south-south. Well, vulnerabilities from the health outcomes, we looked at the health outcomes from the climate change impacts, the injury and mortality from extreme events, which has been talked about a lot. Much of Nigeria's health system shows very high vulnerabilities of being able to adequately respond to extreme events caused by climate change. The coastal states in the south-south geopolitical zone are the most vulnerable, followed by the southern states in the southeast. That is extremely, and what we're talking about is because of issues like flooding. And we talked about the mental challenges that and the psychosocial issues that are associated with this. Heat-related illnesses, the areas with the highest vulnerabilities are the states in the northeast and the northwest zones. And then the medium vulnerabilities are the elevated states in the central and northern central Nigeria. Health systems in southern Nigerian states show a low to medium vulnerability to temperature stress, of course, because of their proximity to the water bodies, the oceans, and then highest waterborne diseases. These are the areas with the highest vulnerabilities states in the northwest, northeast, and then western parts of the country, and the coastal areas in the south-south and southwest. Lower vulnerability areas are states in the southeast and the south-south. Then vector-borne disease, the areas with the highest vulnerability that we found out were states in the far southern delta, and then the south-south zones. Medium vulnerabilities will be states in the northwest and northeast, and then the states with the lowest vulnerabilities will be states in the southwestern zone and states in the southeast zones. Malnutrition and food-borne diseases, those that are with the highest vulnerabilities are the northern states for obvious reasons of challenges of drought and reduced rainfall patterns. And then medium vulnerabilities will be states in the middle zones of the country. Lower vulnerabilities will be states in the southern parts of the country. Respiratory illnesses will be highest, states with the highest challenges will be those in the northwest, northeast, western parts of the country, and then parts of the south-south zone. The issues of pollution from the oil industry, which go hand in hand with climate change impacts, obviously will be felt markedly in the south-south zones. Lower vulnerabilities will be states in the southeast and parts of the southwest. Zoonosis, I talked about this before, because of the movement of animals from the northern parts of the country to the southern parts of the country. The areas with the highest challenges to this will be the northern states of the country. Then medium vulnerabilities will be the states in the central areas of the country, and then lower vulnerabilities will be states in the southern states of the country. But what we're seeing in the country right now is that the challenges of zoonosis are all over the country, because cattle and the rest of them are all over everywhere now. Mental and psychosocial impacts, the highest vulnerabilities, like I said earlier, will be felt in the southern states, and this is predominantly driven by the impact of severe rainfall and, of course, the issues of flooding and coastal water intrusion. Then the lower vulnerability states will be the majority states in the central areas of the country and then the northwestern parts of the country. And non-communicable diseases like cardiovascular diseases will be the highest vulnerabilities will be areas in the northern states. Medium vulnerabilities will be areas in the middle parts of the country, and lower vulnerabilities will be areas in the southern parts of the country. This gives the scenario, the future risk scenario that we came up with in the V&A studies. This will be dealt with fully next week. There wouldn't be too much time to go into this.
a lot of states are represented on this call, and we're looking forward to meeting with them in person next week. So, Mr. Brooks, I can see your camera on. I can see you also raised your hand to show that you are here. We will yield the floor to you now to first just tell us, how we're building the capacity for this to be addressed at the state level, the policy environment, and what the Federal Ministry of Health is doing to take this policy agenda forward. Mr. Brock.
Okay. Good afternoon, everyone. Good afternoon.
Yes, we can hear you, sir. Please go ahead.
Okay, thank you so much. You can see now the house is full. It's full to capacity. And I'm glad at this point that we're having this conference. So my job is to tell you what we are doing at the Federal Ministry of Health in terms of the administration and governance as regards climate change and health. So I'm glad to tell the House that at the Federal Ministry of Health, we have an institutional arrangement to tackle the menace of climate change in the country. First of all, I will start from the office of the Honorable Minister. We have a climate-friendly Honorable Coordinating Minister for Health, and we are glad to have him because he has been in the forefront of climate change and health. Okay, the people that have been in the ministry can bear me witness. Climate change and health have not been having this kind of momentum that is having now. It has been there for years, but they have been in the corner. But now, climate change and health is in the front burner. So, starting from the office of the Honorable Minister, the Honorable Minister has put plans on ground, put solid on ground, and he has given us his backup, his support for us to tackle this menace of climate change in the health sector. Secondly, the climate change by way of institutional arrangements is situated in the Department of Public Health as a department, and we have a division called a Division of Climate Change and Environmental Health, which I am the director and the supervisor of that division. But of recently, because of the interest the ministry is having for climate change and health, now the permanent secretary is now the direct supervising officer that is supervising the issue of climate change and health in the Ministry of Health. That shows you how serious the ministry is taking the issue of climate change and health. And in the division, we have a lot of qualified staff that can man that division. We have doctors, we have scientific officers, we have environmental officers, we have nurses, and all forms of cadre of health officers in that division. So we are well able and we are ready to take on the issue of climate change and health in the country. And at the sub-national, we have a structure on the ground. We have in each of the state ministries of health, we have a desk officer that is in charge of climate change and health affairs. And all of them, I'm happy, all of them have responded to this call, and all of them are here, present, and we are happy to move them to the main conference when it comes up on the 21st. So the states where the main action is going to be taken are fully on ground, and anything that we do, we carry them along. As we are going to embark on some training from now on, I think most of them will also participate to get them well prepared for the menace of climate change in the health sector in Nigeria. So the states are also to reproduce what training that we give them at the national level to the LGS. And the Department of Health in the LGS has to be properly sensitized by the states so that this message can be carried down to the grassroots as we wish it to go down. And I would also, before I can end my speech, I'll also tell you that the Honorable Minister have, put in, through the World Bank itself, have put in the climate change and health properly in the SWAP office, coordinating office, which is the engine of carrying out most of the Minister of Health policy issues, the implementation of the policies. So now the ministry is well prepared and are ready to tackle the menace of climate change headlong. Because even at the federal, it will be mentioned at the NCH. Now, we want to put climate change and health in all policies. The Permanent Secretary called me this morning that I should submit all what we are doing in climate change and health to the Director of Planning, which is the Secretariat of all policies in the Ministry of Health. That shows you that what we've been praying for, there's climate change and health in all policies, is going to become a reality. And we are not leaving any stone unturned towards climate change and health. And finally, as we are moving towards to COP29, the VIA have been concluded, and the PEMSEC have told me this morning that I have to find a time now. I'm going to fix a time for the launching of the VIA before we go on COP. That directive has been given to me this morning, and we are going to do the launching before going to COP. And all of you know that COP starts on November 11. So that's to say we are going to do that launching before November 11. And to say the final thing, the consultant would form the Secretariat. We are going to tease out the interventions, the major interventions, and have a kind of handbook for the Honorable Minister to take it to Baku in COP29, and that's what we are on. So that's what I can say in terms of institutional arrangement and governance in the health, climate and health in Nigeria. And we are on top of it, and the ministry is hitting the ground running. So thank you so much. Over to you, Dr. Grimide.
Thank you so much, Mr. Brooks. But before we close this event, I will have the opportunity to spend a few minutes just to share how the new World Bank Corporation under the sector-wide approach is helping to make the health system responsive to the dilemma of climate change. Before I hand over to my colleague, Jessica at the World Bank, I just wanted to share with you this image. The image on your left is pretty much a summary of what the ASEAN team has presented in terms of climate vulnerabilities across the country. The one on your right is really the under 5 mortality rates. And just from a distance where you are, you can almost do a like-for-like match between under 5 mortality and climate vulnerabilities. This is just to drive home the message that, in fact, the kind of health outcomes that we're seeing in the health sector clearly has a direct correlation with what is emerging within or is impacted strongly by climate change. So if Jessica is online, perhaps we can now begin to say, what are the things that we are doing in terms of addressing the impact of climate change on the health system? Jessica, please.
Great. Thank you so much. I'm not sure if you can see me, and I'm also not sure if I can share. Great. Great. So we've discussed in detail what the challenges of climate change are in Nigeria. and we have discussed, started discussing what some of the responses are in Nigeria. And what I will look at is a little bit more on what can be done more broadly to address climate change and health. My name is Jessica Flannery. I work with the Climate and Health Program at the World Bank, based in Washington, D.C. Very, very excited to be here with you today, and we'll also be in country next week. And just give me a second. Let me see if I can get the right view. Here we go. So I think we have seen this diagram already, but just to review, climate change is really impacting the whole health system, and it has impacts throughout health outcomes. So when we're talking about what to do about climate change and how to address, we're really thinking about climate change throughout the health system. As Mr. Brooks very clearly said, this is really something that requires a whole health system approach in all aspects of service delivery, pharmaceuticals, technologies, data, health workforce, all of the different areas to address the very complex impacts of climate change on health.
So Jessica, just to say that if you're sharing your screen, we're not seeing it. I'm not seeing the slides, maybe.
Okay, can others see the slides? Because I'm on two devices and I see it. Okay.
Yes, we can.
Okay.
Yes, we can.
We can see.
Great. So, Olumide, I'm hearing from many others that they can see.
Please go ahead.
I'm going to go ahead. So, again, because climate change impacts the entire health system, interventions to address climate change really need to be throughout the health system. So this is a diagram looking at the health system's building blocks and what can be done about climate change, what the interventions and programs are throughout the health system. And these really run the spectrum of the health system. And I'm going to go through each briefly and show a few examples. So, as Mr. Brooks very clearly said, leadership and governance is really a key area. And so, leadership and governance structures, one example of that is, multi-sectoral climate and health governance, climate and health technical working groups, other governance structures. The National Climate and Health Adaptation Plan is an example of climate and health leadership and governance, a plan that everybody can get around and really coordinate efforts around priorities to address climate change and health. Climate smart health workforce. So there, again, in each of these areas, there are many different examples. And, one is what are deployment systems for making sure that there are responses to climate shocks, making sure there are adequate, there's adequate workforce in climate vulnerable areas. Also capacity development for health workers on climate change and health. So these are all areas of climate smart health workforce. Assessment of GHG emissions. So we're primarily today really talking about adapting to the impacts of climate change, but also reducing the impacts of the health sector on greenhouse gas emissions is critical. Globally, the health sector is estimated to contribute about 5% of all greenhouse gas emissions. So things like greenhouse gas emission audits of health facilities are one aspect of assessment of the greenhouse gas emissions of the health sector. So integrated risk monitoring and early warning systems. So systems that, for example, early warning systems for floods at health facilities, early warning systems related to climate sensitive diseases like malaria, high heat, which impacts a whole host of health conditions. These are really key for the health system to be able to respond to the impacts of climate change on health. So climate and health research, understanding what the problem is, and many of these areas the programs to address climate change and health are really developing, and as is the research and our understanding of the links between climate change and health. So, impacts. An example of this is research on the impact of climate change on maternal health. One area that we're increasingly seeing really significant impacts of climate change on. So moving to the other side of the wheel. So this is sustainable climate and health financing. So, but budgeting for climate emergency preparedness and response, making sure there are available resources for the preparedness and response. Climate emergency preparedness is really key. There is a lot of work on emergency preparedness and response, and really making sure that climate change is part and parcel, and response to climate shocks is part and parcel of that emergency response planning and management. So, for example, a scenario planning for emergency preparedness and response. Climate-informed health programs, so using climatic data, meteorologic data with health data to design programs and to plan programs so that they are climate sensitive. So they're, for example, using with the example of malaria, so that such a program is planned for seasonal upticks, for changes from climate change in the areas that are the geographic locations that are impacted by malaria, and the seasonal changes from malaria. And sorry, I'm just doing a selection of these, not everyone. And then for climate resilient and low carbon infrastructures, before we talked about the assessment, but in terms of the actions, an example is energy efficient health equipment. So making sure that the equipment at health facilities is energy efficient, and using energy efficient building techniques to reduce greenhouse gas emissions. So these are just some examples. There are a whole host of areas, and again, this is very much a developing area, but there are things that we can do to adapt the health system to the impacts of climate change, to adapt health programs to the impacts of climate change, and also to reduce the impact of the health system on GHG emissions, to mitigate the emissions contributions. So I'll talk a little bit about the HOPE PHC project that Olumide gave an overview on. This is the government's project, and it's one of 3 projects to really accelerate results. And the health project is specifically focused on accelerating results for maternal and child health. And it's married with a governance project and an education project. And it really focuses on downstream service delivery constraints for healthcare to really improve health service delivery and accelerate improvements in health outcomes. So the project is a program for results. And what that means is that there are payments on specific results. So it's a little bit different that we sometimes think about a traditional development project that has, a project and a lot of inputs and activities. But the project itself is very focused on results, and the government is working on the activities that achieve those results. And there are 11 disbursement linked indicators, which are the results that are the focus of the project. And the effort with this project is really to incorporate climate change throughout, very much as Mr. Brooks described, to really, climate change impacts the whole health system. So that to address climate change, we really need the actions to be throughout the health system. And so the response is really throughout this project. So I'm just going to focus on a few key ones, and we'll discuss this much more next week. So this is just an introduction to climate change in the HOPE PHC project. So one key indicator is the first one, improve primary healthcare facilities to improve readiness, quality, and climate resilience. So climate resilience is really a key part of this. And the climate focus in the DLI is on identifying climate vulnerable facilities and putting in place climate resilient rehabilitation. So this is, assessing the facilities and for their climate vulnerability, and looking at things like what Dave and Edwin discussed before, vulnerability to high heat, for example, vulnerability to storms, and putting in place rehabilitation measures that will make those facilities more resilient and reduce the impacts of those climatic conditions on the health facilities. Another indicator that's very key is, excuse me, the increased empanelment and refurbishment of CMONC facilities, comprehensive emergency obstetric and neonatal care facilities that demonstrate readiness and service readiness and climate resilience and energy efficiency. So energy efficient rehabilitation of CMONC facilities is a key part of this DLI, and climate resilient rehabilitation. So this DLI looks at disbursement linked indicator looks at both of these things, the energy efficient rehabilitation, so to reduce the energy use in those facilities and to increase the climate resilience. And finally, and again, this is just a selection, but this is something that we've discussed throughout the webinar, is that this operation will finance the development of a National Climate Change and Health Adaptation Plan, an HNAP. So in the first year, it's financing the development of the plan. In the second year, it's financing the development of state level climate and health implementation plans. And then in the third and fourth year, it's financing implementation of those plans. So in financing the plans and the implementation, it's really looking at all of the areas we discussed before throughout the health system, the spectrum of actions, and not necessarily all of the areas, but it's sort of open to the priority ones that will really drive climate and health improvements in the states based on what the states have identified as needs. So this is a really key DLI for in the HOPE PHC project, and really to drive climate and health actions in Nigeria, again, throughout the health system. This is a very core area. So I will pause here and hand it back. Thank you so much.
Thank you so much, Jessica. I think what we've done in the last hour or so is that we've gone through the entire path of, is this a problem? Yes, it's a problem. It's a global problem, but it is also beginning, and we're beginning to see that it's impacting our health system, not just now, but in the medium and long term as well. We have data which actually shows the levels of vulnerabilities across the system. But the good news is that the Ministry of Health, and I like the way Mr. Brooks positioned it in terms of the leadership and governance to help underpin this, is in place. So you have not just at the federal level, but at the state level. But it's even better than that, with financing, which Jessica has mentioned. So because the swap financing operation, especially the part financed through the World Bank, provides incentives for the Federal Ministry of Health to put in place a national climate plan, also for states to adopt it. So I do hope that Mr. Brooks and the team at the Federal Ministry of Health are able to use the upcoming National Council on Health to get a ministerial memo to approve that plan. And then the next step will be for states to adopt the plan. And for all of those actions, there is a financial incentive attached to it. But it's not just adopting the plan for plan's sake. It is also to begin to actualize and operationalize all of the different elements in those plans. I'm going to hand over to Vivian to tell us how partnership collaboration is able to help advance this agenda. The climate agenda is one that can't be done by government alone, but it's the government, civil society, it's the private sector, and across all stakeholders. But I know that, okay, we'll take just 2 10-second questions. If Dr. Saleh is still online, quick question, and please, if you could allow Frank to unmute himself and ask a very short question, clarification question, all knowing that next week we have a 3-day, almost all-day sessions with us. The workshop is on Tuesday, Wednesday, and then the Future of Health Conference is on Thursday. So if Frank is able to unmute, and then we go to Dr. Saleh. If not, I hand back to Vivian. Frank, if you can go ahead.
Yes, my name is Frankie Nenema, Edo State, Minister of Health. I'm the desk officer. I'm trying to suggest that at the end of the meeting, details of the logistics of participants who are from various states should be made known so that will enhance preparation for next week, and then likely to backed up with letters so that we can have those ones to secure release from our employers. Thank you.
Thank you very much. This is noted, and we have colleagues who are already working on that. Opportunity for one last question, show of hands, before I hand over to Vivian for her to give us the perspectives on partnerships, collaboration, and plans for next week. In the absence of that, Edwin, last word from you. Edwin?
Oh, great. Confirm you can hear me loud and clear?
Yeah, we can.
Okay, for me, thank you so much, and I want to appreciate all the participants for wonderful insight and for the rest of the team. I just want to say that Nigeria is our country, and we have a role. We have a both moral responsibility to see how we can protect it from climate change, and we need to do that sincerely and leverage on all of the climate health interventions and the ongoing activities going on in the health sector as an opportunity for us to address determinants of health in Nigeria and improve on our climate action. Climate change is real, and Nigeria is having a fair share of it. And anything that we can address, once we're able to tackle issue of climate change in health, it will trigger co-benefit for other sectors. Looking forward to seeing you at the Future of Health Summit to discuss on climate change. Thank you.
Thank you very much. Mr. Brooks, is that a hold hand? And may I please ask participants to please give us 5 minutes of your time. We started a bit late to get the 5 minutes back. Mr. Brooks?
Okay, thank you, Dr. Olumide, for steering this meeting. We are happy to have this meeting, and the attendance, I appreciate the attendance. Like what the desk officer was asking is important. I asked that question before myself because the Federal Ministry of Health, my PEMSEC asked me that a letter has to be transmitted to her office so that she can officially, because I'm officially stepped down. I'm supposed to be in Abuja that day, but because of this meeting, that letter has stepped down.
Okay.
For that meeting.
No problem. Okay. Thank you so much. Ms. Vivian Ihekazu and the Nigeria Health Watch team, over to you, but thank you so much for also helping us put this together. Please, I'll ask colleagues to stay on for another 5 minutes Thank you. Back to you, Vivian.
Okay, thank you so much, Dr. Kunala, and thank you everybody for joining our webinar in partnership with we're really pleased with the attendance. I think the background to setting this webinar today is in preparation for all the activities next week that Dr. Kunala mentioned, and just setting a foundation for all of those who have a day-to-day job and have, their knowledge gap and understanding the intersection between them. I think we've been lost today from, just the basics, what intersection between climate and health, and really the preview of the climate vulnerability and adaptation assessment, which I think was very important to set the context in terms of how do we address climate change if we do not fully understand where our vulnerabilities are as a country. My discussion right now is, following on from all of those things that we've heard, we have to also remember that who does climate impact? Impacts people. We focus on health communications and advocacy. So I'll just take you through a few slides. And really what I want to talk about today is how do we build partnerships in a coalition to ensure that there's greater awareness. We as a collective are able to push government for the implementation of all these policies. We heard from the World Bank that further following the development of the vulnerability and adaptation assessment, implementation plans will now be developed backed with funding. But how do we now ensure that those plans are funded, and how do we ensure that the implementation is and done as it should be? So I'll just share my screen and just take you through a few thoughts on our side. Thank you. All right. Okay. So just to run you through, and thank you all so much for staying on a bit longer. I know we've overrun a bit. So as I mentioned, what I want to just talk through quickly is, how do we build partnerships and coalitions in health? As many of you know, I'm Managing Director of Nigeria Health Watch, and we are a health communications advocacy organization based in Abuja, Nigeria. So really, why our ultimate question is, why are partnerships and coalition building even important in an area like climate change? Sorry, I think I've lost my slides again. So, oops, sorry, let me just reshare my screen. Okay. I can't seem to share my slides. Let me try again. Okay, can you see my slides?
Yes, we can see.
Yes, we can. We can see it properly.
Yeah, for some reason I'm seeing. Okay, there we go. Okay, so I was saying, just laying the foundation, why partnerships are important. Really, the impacts of climate and change and health. We really need to ensure that people are better able to understand what climate change even means. We always say that when we talk about what climate change is, the average person on the street, how well are they even understanding what we're talking about? And there's a lot of jargon and a lot of quite complex language that's around when we discuss what climate and change is. So ultimately, building those partnerships and coalitions, it requires a collective effort to ensure that where there are knowledge gaps, that we play a role in filling it. We need to, of course, be very prepared in ensuring that there's knowledge and evidence in order to raise awareness. And in order to do that and to develop a consistent call to action, we need to ensure that we build those coalitions and stakeholders who really are involved in this space. So when we think about who really are the critical stakeholders that we need to think about, we think, for instance, the key stakeholders in this area, for instance, the government. We heard Edwin talk about the One Health approach. So the critical stakeholders that we need to engage in building this coalition and partnerships are not just in the health sector. I know that most of the people on this call really are involved in health, but we have to also remember, taking a One Health approach, that those coalitions and partnerships need to also include people who are involved in environment, and agriculture, because climate change is not just seen through the lens of health. Although it's only recently that that intersection between climate and health has been aligned, and collectively there's been much louder advocacy to ensure that when we think about climate change, that the lens of health is fully integrated. Other critical stakeholders that really also we need to include in building these partnerships are civil society organizations like ourselves, with good grassroots organizations, not just at the state level, but really there are grassroots organizations who are, at the state level, at the local level, in those communities, who are and should be part of building strong coalitions around issues around climate and health. Also, let's not forget, how do we build the evidence base to present to ensure that when we're talking about climate and health, that the evidence and the data is there to support our advocacy. So academia and research institutions are really important stakeholders that also play a very important role in a lot of the coalitions that we need to build. But also in terms of when we think about partnerships, a lot of the work we do very much when we think of health is focused around, how do we strengthen the public sector? How do we strengthen primary healthcare? But the private sector are a very important stakeholder that we need to ensure that we include. Private sector in terms of, we know that there are a lot of tech solutions that can be used to address and to ensure that people are better informed. In terms of making sure that people are better informed, cross-sector partnerships should also include the media. And I highlight specifically the media because as an organization, one thing we've always historically done is build the capacity of people, new journalists, people in newsrooms, to be able to report on issues around different health areas. So climate change also is a very important area where the media has to play and does play an important role in communicating to people what the intersection of climate and health is. As I mentioned earlier, we always use quite complicated language. When we talk about net zero, what are carbon, what are carbon footprints, what are NCD contributions? We have to ensure that when we are communicating, that people in media play an important role in kind of breaking down some of these discussions and communicating in a very clear, succinct and simple way in order to carry people along. And when we talk about climate change, they're able to understand how it impacts their lives directly. Community leaders, traditional and religious leaders are also very important because most of them are often in the communities and are close to people, and their language often resonates. And when they're discussing, they would often use quite culturally sensitive language in communicating a lot of issues around not just climate and health, but we also know a lot of issues we advocate around health. The people in communities are very important. I mentioned, as you can see on the slide, in terms of building coalitions, we think about, the multi-sectoral response that's needed to respond to any of these issues. So we think about an example is recently we did a lot of work around nutrition, where one of the bottlenecks in ensuring the nutrition interventions are leading to positive outcomes is the fact that there are many stakeholders involved in these areas, and often many of them work at cross purposes. Some of the stakeholder analysis we did around this found that they don't always work together. And ensuring that there is that multi-sectoral response and everybody speaking the same language really requires us to be able to communicate very clearly. When we communicate, make sure that we have a shared vision, and also to spring any negative impacts. Any negative impacts that people understand around what climate change leads in their lives. And we have to make sure that when we have that shared vision, that we're bringing in many different stakeholders to be able to engage in these conversations. And a lot of these strategic partnerships have to be beneficial and ensuring that people are well informed about all the issues around climate and health. So our experience as an organization, we've worked with other coalitions in a similar vein, for instance, around sugar taxes, our Community Health Watch project, when we talk about how do we make sure that people in communities are also better informed, using that community-based approach, using, community reporters, where because of their proximity in the communities, they're able to share stories and use different platforms to communicate around issues around climate and health. I think, just, in a summary, when we think about how do we ensure that Nigerians are better informed about the intersection of climate and change and health, all of this requires not just a multi-sectoral collaboration, but it requires partnerships across the different areas like government, CSOs, academia, working in communities and working with the private sector. This webinar that we're doing today is really a prelude to events that will take place next week, where we really want to dig deeper into some of these issues. And one of the very important stakeholders that we often overlook are young people, the youth. So on the 23rd, the day before the main Future of Health conference, we'll be hosting a youth pre-conference, because we need to build awareness and ensure that young people are very involved in being advocates and activists around issues around climate and health. And I use the word activists intentionally, because I think we are no longer at a stage of just pausing and going on this quite slowly. As a country and as a continent, we have to be more in the forefront of pushing why, prioritizing climate and health is very important in our policies as a country and as a continent. A lot of the discussions around climate and health have historically come from countries in the global north, but I think as a country and as a continent, we also have to make sure that our young people are better empowered and have the knowledge to really be those change makers, and using their voices amplify and put pressure on governments to prioritize issues around climate and health. So the Youth Pre-Conference on the 23rd is going to address that. And subsequent to that, Dr. Kunala has spoken about the Future of Health conference, which is on the 24th of October. And that conference, we shared a link in the chat where people are able to still register. You can register and attend virtually or in person. We obviously have a certain amount of capacity that we can accommodate people attending in person, but people are invited, of course, to attend virtually. There's a link that's shared, and we just invite people to register for that event. And a lot of the issues we've discussed today, we'll be going into them in a lot more detail next week, not just during our Future of Health conferences, but of course during the workshop that's been highlighted by Dr. Kunala. So over and back to you, and thank you everybody for joining this webinar today.
Thank you so much, Mrs. Eyakrazu. As always, we hope that we are able to build a coalition of the willing who are able to get, and I think catching them young, as the pre-conference hopes to do, is one of the steps in that direction. So please, we're looking forward to seeing the state focal persons in person in Abuja. My colleague Henry will be sending the letters out officially to those who were able to meet the registration. For those who are not able to make it in person, there will be a link for the workshop, the pre-youth conference, and the main Future of Health conference. Today's event was just meant to be a teaser and just to begin to introduce the concept to all and sundry. It's been a wonderful day. We've had about 100 participants, which is great. Thank you so much. I'm looking forward to seeing you all next week. Bye for now.